What metrics do you use to assess whether these strategic partnerships are working or not? At BMS, for example.
So I think we look at a lot of the conventional milestones. We try to figure out how long it takes to do a certain activity, how that activity would be done internally, externally. I like to look at site performance. So I'm very interested in the number of sites that we activate, how good are those sites, how many of them are low enrolling sites. And we tend to really focus on those low enrolling sites these days. We look at some of the relationships we have with academic and non-academic centers. So we're very fixated on how quickly can we enroll those trials, but when we do it in an efficient manner. So we're very fixated on site selection. And I think, as we look across the industry, that's probably where the CROs and the sponsors have the biggest drift these days, right? I think, we tend to go into one direction. We use a different process to find the sites than CROs. And to me, that's one of those activities we like to own on the inside. We like to look at metrics in terms of, the quality of certain activities that are done, whether it's data management, whether it's monitoring, the oversight, things of that nature. And then we look at cost, of course.
I think, Jonathan, you're exactly right. I think the site relationships are critically important and continue to be. So I think the focus on finding the right sites. In the end of the day, you can have all the best processes, you can have low unit costs, but if you don't have motivated investigators who have protocol-eligible patients, your study is not going to meet the thresholds that you expect. So we put a lot of effort on the INC side on site relations, understanding that sites actually are the ones doing the research. And a lot of the quality that we talk about and want to see is highly dependent on having investigators and site staff that are properly trained and well equipped and understand the protocol, understand how that's going to be delivered in the context of their own processes, and how that's going to yield clearly safety for patients and really a sort of focus on ensuring that that patient is a completer in the study. I think one of the things that we've understood as an industry is that the cost of attrition on studies now at the patient level, so not the asset level, but patients not getting to the end of studies is causing fits for the statisticians and causing concern, I think, for all of us. And that's something we've got to be very, very careful of, because there are new standards of care coming through. You've got patients that are on studies that require very long-term follow-up, and if there isn't a good route for that patient to continue within that study parameter, then they're apt to move to the advancements in standard of care, and that just messes up the whole study design.
I think that's where the trust thing comes in partnerships, as Jonathan said, where there is a differing view of the sites that should be selected, and everybody has their data and their way of looking at it and history and performance. Then it comes to when it's sharing operational risk, there is a tendency that has to be managed. Well, we didn't pick that site, so if it's not enrolling, it isn't our fault. So and that works both sides. Depends. So it's one of those areas where I think you need to get it right. You need to get it right up front.
I think we both realized, and with Chilton realized, that perhaps in the first 12 to 18 months of our relationship, we could not expect that our timelines metrics, as the easiest one to look at, would actually improve. We actually predicted that they would decrease, and we wouldn't be that good. And the reasons for that is twofold. It's got nothing to do with capacity and capacity on the ground. That's been guaranteed and 100%. It's really about us having to realize that even while we have a strategic partnership, there are other functions in development that have to play a role, such as legal and contracts. And depending on how conservative your company is, it appears to us, and I hope our Astellas colleagues will forgive me for saying this, but it appears to me that, and something that I continue to watch out for, is that other functions outside who may be on the periphery of the relationship put up even more hurdles because they have this perception that it's even more outside than it is. One of the lessons we've learned is that one of the easiest ones, and the one that everybody wants to look at, is final protocol to first subject in, is actually suffering this year. And it's actually a result of a multitude of things. The second most important one is, we are getting a lot more input from our partners, and so having to make protocol amendments because we want it to be even more feasible is actually leading us, at least in this first year, first 18 months, to actually have, not so good a set of metrics. But in the long term, we actually believe that it's going to pan out. We have to settle down. We have to be in steady state, before that'll change.